Hello, welcome to Sonography Radiology training channel. This series of videos is about normal skull X-ray findings. This is the fifth video in this video series with title of Normal Skull X-ray Findings Simulate Disease Part 5. Like previous videos, we will review a few cases together. Case 1. These images is related to a 7-year-old boy. As we can see, it seems there is a large lytic distractive lesion in parietal bone. But really, it's cranium bifidum occultum, which is incomplete closure of the midline of the skull, not to be mistaken for a distractive process. Such closure defects may be unassociated with bone dysplasia. The defect usually occurs in the median sagittal plane, either anteriorly or posteriorly. It is characterized by a bony defect which may be associated with a cephalocele or meningoencephalocele. In cranium bifidum occultum, there is higher incidence of systemic anomalies including frontonasal dysplasia, agenesis of the corpus callosum, hemimegalencephaly, microcephaly, pachygyria and polymicrogyria, a 50% occurrence of mental retardation, ocular, auricular, limb and cardiac abnormalities, and complication by medication intake and infection. Cranium bifidum occultum often closes in the mid-childhood to leave a paired symmetrical openings in the frontal or parietal regions. Case 2. These images are related to a neonate. As you can see, seems there are depression fractures in temporal bones, but really it's congenital depression of the calvaria caused by faulty fetal packing. Such depressions manifest at birth and when not associated with edema or hemorrhage of the overlying soft tissues are usually due to faulty position in the womb, with long-standing pressure from the fetal feet or the maternal sacral promontory. Another example, we can see a sclerotic line on the lateral skull radiograph correspond to permanent right parietal depression demonstrated on AP view. Axial CT scan of infant's head imaged with boned windows clearly demonstrates depression of right parietal bone. Scans performed with techniques to study underlying brain revealed no abnormality. This image is related to an 18-month-old child. We can see here a slight calvarial depressions, probably representing residua of faulty fetal packing. These depressions usually regress spontaneously without treatment. Case 3. In all of these images, we can see a small, well-defined area of radiolucency surrounded by a sclerotic bone, similar to donut. These lesions, famous as Calvarial Doughnut Lesions, which are radiolucent ring-like skull defects with surrounding sclerotic hollows which may have a central bone density and may occur in any part of the skull. Calvarial Doughnut lesions are usually an isolated incidental asymptomatic finding with no clinical significance. Occasionally, this entity forms part of a rare autosomal dominantly inherited syndrome called familial Calvarial Doughnut Lesions syndrome or Calvarial Doughnut Lesions bone fragility syndrome. This entity characterizes by multiple Calvarial Doughnut lesions with lumps on the head, many pathologic fractures, dental caries and undeveloped teeth, and elevated serum alkaline phosphatase levels. The appearance of the Calvarial Doughnut lesions in CT scan. The axial CT scan shows a right parietal Doughnut lesion causing lamina externa of calvarial bone to bulge outward. There are two areas of calcification: the typical surrounding sclerotic ring and the small calcified area inside the hypodense central fibrous portion. The appearance of the lesions in MRI. Post-CAT T1 axial image shows that contrast accumulates in the well-perfused center of the Doughnut lesions. And the peripheral band-like unenhanced tissue represents the sclerotic ring. Another example of post-CAT T1 MRI image, the uppermost axial contrast-enhanced T1 image shows two sharply defined doughnut lesions in the frontal and parietal bone, showing to the full extent their ring-like architecture. Now, I suggest two others of my videos that are close to this video in terms of matter. And thank you for your attention.